Hi, precious one. It is with a great excitement to come your way once again. For those of you people who are new on this channel, I'm Derek Mabaso, a registered general nurse. On this channel, we talk mostly about nursing topics. So if you want to join this family, kindly hit the subscribe button and leave a comment saying I subscribe, and we will try as much as possible best to reply all your comments personally on this video. Abusia me wakwaba eba GH Health so. Eha no ye din komo efan nursing ho. Na ne topic e wo ho ne ye a few things you have to know after you have applied for nursing school. Emprempi no ye nuanom bu ho a ompeso mo ko nursing school a. Omote se nursing omunim se eno ano no. Omunim se wo ko ye na ye kwa kwakire se de yesima injection yesiwo panie okoye na ye kwa kwakire se de yesi eyesam enema bi eye na hospital ho bi te se checking of temperature, checking of blood pressure, but antisa sanema no ebi amanfo di akira nursing school eduru akiri no mo drop out minimum crofo bebre e wo me class emla na me wo nursing school obu ho a wo ba no onim se e ba be kire se de yesi wo pane nko a obu ho a onim se bi e ba be kire se de oba hospital yesi kire won san nko a but me ka kire se wa apply afi ya me bompa ya ma obia wa apply afi me bompa ya ma se obenya admission but the wasa wo de hye wa adwum ni se saa niema na oba hospital abonsi ye wo pane ubehu se ye kekire ye nsa saa niema no eno kra de eye list na ye no school ho eto da bi kra ye nye kra eno no ene ye be no hospital set time so na oba clinical sa but oba school mu dia eye purely learning eye purely theory ube wiye no o 3 years na be ko no ube wiye no na wasua courses about ube wiye no na wasua about 50 courses me books me few books wa me books ni na akire mo me few books wa about 30 of them atwa hia mo ho ha nti me akire mo na ma akire mo niema ye kokosua no ho enti no sa adwin bi hye utrim say ye nursing training ye kwa akoye practicals niema no ho no sa niema no de ye nya no ho kra ye nya sa niema no ho. Some of the nursing school no air no more practical na say demonstration room na no kra anya da bia na omukọ ho nti de mpesa wo de hye wadwunu se oba obesua de amanfo di sa na na chia ko nursing school na omunim se nursing o mat nursing omunim se nursing na efu but me culture say so apply a fashion otim se obesua de oba enema bi sei na abesua mo hye ase a first year no wo ye nap wo ye general nurse wo ye midwife enema na musua no first year no eya na eye similar bibi to say professional adjustment sabukui professional adjustment sabukui professional adjustment sabukui say no ena ebema history behind nursing, the mother of nursing, those who brought nursing into existence. From the word to Ghana. And your rules, when about rules and regulations, I guided nursing and midwives, even patients. Into where any containing a whole lot, you find a professional adjustment. Into where any baby wadrim our nursing home. About rules and regulation about the job, about you as a nurse. And in the take note, first semester as I'm making first semester. Tomoko ambassador BBC professional adjustment. About the definition of nursing. History of nursing. You know the history of nursing. We have the Christian era. We have the Middle Age era, the Reformation era, and the Florence Nightingale era. So Florence Nightingale is the founder of modern nursing. So her own started from 1820 to 1910. So this will give you the history of Florence Nightingale, the history of nursing in Ghana. It will give you all those things. Nursing and Midwifery Council, everything. It contains everything about nursing. So take note, you learn this. You also learn French. You learn French. It is believed that most of our neighboring countries are French-speaking countries. So you as a nurse, you know, you meet a whole lot of people. So you have to learn French. You have to be able to understand and speak a little French. You also learn sign language. You know, we are living with people who cannot speak. So you learn a little bit about sign language. You learn microbiology. That's where you are going to learn bacteria, virus, protozoa, those microorganisms. And you will learn infection prevention. So this subject will give you the reason why we should wear masks, the reason why we should wear gloves, the reason why we should wear protective equipment. That's microbiology. You will learn therapeutic communication. You know, as nurses or as a nurse, you have to talk in such a way that the patient will even be healed. You have to talk for a patient to recover. Your speech should make a patient recover. So you will learn those things, how to talk to patients. Your communication, your speaking skills should bring recovery to a patient. So as a nurse, you have to take note. As an applicant, you have to take note. You learn therapeutic communication. And you learn a little bit about statistics. That's a little bit about mathematics. Because as a nurse, you deal with calculation of drugs. You know, you don't just give drugs. You have to calculate them. The doctor will give the patient 50 milligrams. And on the drug, they have written maybe 1,000 more. So you have to know how you can calculate from milligram to mils. So when you get to second year, that's where you are going to specialize in nursing. That's where you are going deep into nursing. So from there, you will start learning the surgery, the pharmacology, the anatomy. So the anatomy, there's anatomy. During my time, we were using Ross and Wilson. The anatomy, we have anatomy 1, anatomy 2, anatomy 3. So what is anatomy and physiology? In this subject, you are going to learn all the body parts, the organs, even the hair, the nails. You will learn everything, plus their functions. Anatomy will open your mind, will open your brain to understand the diseases and how they come about. Anatomy will lead you to medicine. Anatomy will lead you to medicine. You will learn medicine 1, medicine 2, medicine 3. Medicine, you are going to learn the diseases. You are going to learn a whole lot of conditions and how they came about and how as a nurse you can manage them. We don't play in nursing school. You are going to learn exactly what the doctors are learning. So if you go to the ward, the doctor assume that you know everything because they are learning medicine too. They are learning anatomy too. And there's this book here called Pharmacology. Pharmacology 1, Pharmacology 2. This book is all about drugs. You learn a lot of drugs. You learn their mechanism of action. How the drugs, if you take the drug, how the drug perform its works, where the drug will pass throughout your body for it to be eliminated, for it to do its work. If you learn this, and when a doctor prescribes drug and he or she is wrong, you have to know because you have learned it too. As nurses, we learn. We don't go and do just practicals in nursing school. We also learn the theory. We are learning. So if you learn, a doctor cannot be rude to you. A doctor cannot be arrogant to you because you know you're right. During our practice, you see, a doctor can prescribe a medication and you can send it to him or her that you are wrong. This medication is wrong. It's all about what we learn in nursing school. So as a nurse, you are going to learn. You are not going to do only practicals in nursing school. And we have surgery. 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 You learn surgery 1, surgery 2, and surgery 3. So surgery deals about theater. It deals more of theater. And you know, and no, and a better choir patient be a neko theater as a nurse. Choir as a nurse, obefa so prepare patient no psychologically. As you fan sa wo ho na yaba, we patient na yaba. Yes, say o condition we say the or say ye koyo operation. Ebebo hu enti as a nurse, so usua sa surgery a ebebo am what me cancel patient. I'm a patient no enya confidence. I'm a head na kwa twitwa. Surgery no dealing more with theater. You learn the theater instrument. You learn a whole lot of surgical condition and even how to scrub. Surgery will make you know how to scrub. So who is a scrub nurse? If you know the answer, kindly type it into the comment section. And in the next video, I will mention your name. Who is a scrub nurse? And you will learn something about obstetric nursing. Obstetric nursing. This is about midwifery. This is about midwifery. So as a nurse, you have to learn a whole lot about midwifery. As a general nurse, as a NAC, nurses assistant clinical, as a NAP, you have to know everything concerning obstetric or midwife program. So you will learn everything. So you have to learn something about history of midwifery, obstetric terms, female genital organs, normal pregnancy, minor disorder of pregnancy, and general advice, abnormal pregnancy, normal labor, petrograph, presentation and prolapse of cord, complication of the third stage of labor, a whole lot. You learn a whole lot. As a nurse, you learn something about psychiatry nursing. Psychiatry nursing. So if you're a general nurse, if you're a NAC or NAP, and there's a mental condition at the ward, you don't have to say, I'm not a mental nurse, I'm not a psychiatry nurse. No, you have to know how you can manage the patient because you will learn it. It's a semester course. This is just a semester course. Public health, as a general nurse, as a midwife, as a nurse's assistant clinical, you learn public health nursing. Public health nursing. So you have to get ideas. You have to get knowledge about public health. So assuming there's a problem which involves public health nursing, you have to know how to manage it because you are going to learn it. Public health nursing. And we have traditional medicine. Traditional medicine or gerontology. This is about home nursing, how you can care for the elderly. How you can care for elderly people. You know, elderly people, when they get to a time, when they get to about 80, 90, they are difficult when caring for such people. You know, some will be having dementia, loss of memory, that's amnesia. Loss of memory, amnesia. We have the retrograde and antrograde amnesia. That means they can forget, some of them can forget past event that has happened long time ago, they can forget it. And some too can forget recent events. That's retrograde and antrograde amnesia. So if you learn this thing, you know how you can care for the elderly. You learn about pediatric. You learn how to care for children. So this is 2-semester course. This is pediatric nursing 1. We have pediatric nursing 2. So this will broaden your knowledge on how to care for children. You know, children, their vital signs are different from we the adult. So you have to know all this. And the drug that you will give to an adult, you don't have to give the same quantity to a child. So for children or pediatrics, their drugs deal with a lot of calculations. That's where you learn statistics. And during your last year, you learn something about relationship marketing strategy and entrepreneurship. So you learn how, as a nurse, you can establish your business. You know, you cannot do only nursing to survive. As a nurse, you have to get some knowledge on how to establish your own business. So this book will teach you a whole lot. So if you go to the hospital, you will see some nurses who are selling scrap. You will see some nurses who are selling some things. They get all those ideas from these books. This is management and administration. Management and administration. As a nurse, you have to know how to manage. As a nurse, you have to know how to solve problems. You have to be a leader. You have to know the leadership skills. You have to acquire the leadership skills. So you learn something like organization, leadership, quality assurance, teamwork, time management, management of unit or ward. You have to know how to distribute duties to your colleague nurses as an in charge. If they elect you as an in charge, you have to know how you can distribute the duties to the various nurses. So this book will broaden your knowledge. So as an applicant, you have to know that you are going to learn. You are not going to play. So at times when I hear from people that nurses don't learn, then it pains me, because you are learning. As a nurse, if you learn, a medical doctor cannot be rude to you because you know your work. Let me tell you something as an applicant. Nurses are not under doctors. Nurses, we have our own team, and doctors, they have their own team. And you know, what your applicant, now say what forms, what apply, now say what train interviewer. Oh, books and mobile swing na first year, dear no. Bet me and be PDF, no one shall say no usua. A bit is anatomy. Anatomy, bet me a anatomy no to be drew hono. Na enyema e won sano. Meka say emla, meka say emla me call interview. Senior bako ema me book bi e fe no professional adjustment. Professional adjustment. Or the chairman. Nti me ba fie na me sua book na me drew hono. Na say minim bibia like the book mu na minim. Ti me kai say exams ne ba ye no. Menya A because as a machine fear ti minim the book ni mu na. Enti we applicant. Na so pese o connection school. Me pese me share story ketua bi. Na boost moral. Na so hu say o kwa wontimi nkosua de kra asem na mba be ka kire no. Wo dru ho a asem na mba be ka kire me ka kire wi a e motivational message say me ka kire wi a wo dru ho na no. E be motivate you. O kai bia na e be motivate you. No timi asua de pass. This is a story which was told to me by my chemistry teacher when I was in SHS. The story goes like this. Aristotle was a great wise philosopher in ancient time, and he has a student named Plato. Now Aristotle was very wise, he was very intelligent, and Plato once approached Aristotle and said, "Aristotle, my teacher, why do you become so wise? Why do you become so intelligent? And whatever you put your minds on, you always do it and you never give up." Aristotle smiled and said, "That is a great question. Do you really want to know what it takes to make it? Do you want to know why I always go and give my best in everything I do in life?" So Plato said, "Yes, I want that wisdom. Please give me that wisdom so that I can always use it to achieve everything in life." So Aristotle said, yes, I will teach you so that you can do everything in life, so that you can succeed in everything that you plan to do in life. So Aristotle told Plato, we are going to walk to the ocean front. That means they are going into the sea, or they are going into the river. So Aristotle started to walk down the ocean front with Plato. So as they walk into the ocean, the water started to accumulate to this level. So Plato said, I see a huge ocean here, and I can't find anything. Master, I can't find anything. So he said, Master, where is this wisdom? So Aristotle said, I'm going to show you. So Aristotle grabs Plato's head and dip it into the water, immerse it into the water. As Plato was buried into the water, he looked around and he was seeing a few fishes, but he didn't see anything. You know, like any other person, Plato started to lift his head out of the water. But anytime Plato tries to take his head out of the water, Aristotle tried to push him back. He said, keep looking, keep looking. So Aristotle started looking. He did not see anything, and he tried to come back from the water, and his master tried to push the head more further. After a few minutes, Plato broke out and pushed his master somewhere and started, oh my master, you want to kill me? So Plato said, I did not see anything. So Aristotle said, I was trying to show you this secret to become successful, the secret of not giving up in life. So Plato said, I was deep under the water and I could not breathe, and you were about to kill me. So audience, why was Aristotle pushing the head of Plato? I'm going to leave it for you to answer. So more importantly, when Plato was under the water, what was the most important thing? You don't have to think about it. This is very simple. What he needed most was oxygen. Now, it wasn't that he wanted oxygen, he needed oxygen. Enti abusuya, we are applicant. That's all person occurrence na. Story way ama share no. Fatu trim. Said na Plato share ensuonim. Ah no, o person opie. Ah, what the by force opie ye no. Abusuya. Okọ nursing school. E mo bi nka se wuntimi nye. Okọ nursing school. Na so okọ dura. E mo bi nka se wuntimi nsua de. Medicine, anatomy, pharmacology. E mo bi nka se wuntimi nye. Ubetimi aye. Se unima bisa. Andi biara unim biara no. Wodi bisa. Ubetimi bisa u teachers. Ubetimi bisa u colleague students. Ombe chiro bibia. Enti mfansha wadwem se wuntimi. Sade Plato. The by force a pie no. Feni edene a nursing school. Now be pass out successfully. I hope this video will motivate you. So if you like this message, kindly hit the subscribe button, hit the like button, and leave a message. I will reply you. Bye bye.